And so with me, I have Julie Olson, and we are going to be talking about hair loss with a focus on hormonal hair loss. And Julie Olson, she is a triple certified evidence-based nutrition expert. She specializes in female hair loss, as well as gut health and gluten issues. And Julie is known to skillfully investigate, discover, and communicate root cause resolutions to natural regrow hair and regain health. And with more than 10 years experience, collaboration with functional and integrated practitioners, along with her training in functional medicine, Julie has transformed over 700 women's health and hair. She creates personalized health and hair rebuilding programs for clients that are realistic and sustainable for long-lasting results. And this process empowers clients to take control of their own health. And Julie's program restores women's lustrous locks naturally by getting to the root causes of their health and hair loss so that they look and feel their very best. And thank you so much for joining us, Julie.
Thank you, Dr. Eric. I really appreciate being here.
Yeah, no, it's great to chat with you about hair loss just because a lot of people, of course, experience hair loss, including a lot of my client base and, of course, your client base, because that's what you focus on. So I guess let's start off with your background. How did you start helping others with hair loss?
That's a good question. I've been doing this, as you mentioned, 10 years, and it wasn't until the last couple of years where I had so many women come to me a hot mess like I was before I got into nutrition. And one of their chief complaints was hair loss. And after I got them into balance, their hair started growing back. And I experienced severe hair loss before I got into nutrition when I was transitioning over into the field, and I didn't know what to do. So I actually was walking in to get Rogaine, and thank goodness I didn't, because that's a life sentence. And if you get off of it, normally your hair all falls out anyway. But, it's a pharmaceutical that has side effects. And, I really want to let women know that there's natural alternatives out there a lot, because all you hear about is, Rogaine or other pharmaceuticals or laser or hair plugs or, it's not fair. And there's a lot you can do naturally. And like we'll talk about, it all starts in the gut anyway.
Yeah, that's true. Just pretty much all health conditions seem to start in the gut. And yeah, you're right. The Rogaine, still to this day, a lot of people rely on that. And so you said once people are on it, pretty much they have to stay on it, or else they lose all their hair when they get off of it, correct?
Yes, normally that's what happens, but even on the bottle, it won't say that. And since it happens to the majority of people that get off of it, but since it doesn't happen to 100% of the people, they don't really have strong warnings about it. So it's misleading.
Yeah, and I'm guessing, I'm not too familiar with Rogaine as far as side effects, but I'm guessing just like other medication, there are other side effects as well.
Yeah, and there's another medication called Fineste, and that's for mostly blocking the DHT. A lot of men take that, but the side effects are horrible. They lose all their sex drive. There's been a lot of studies actually where men got off of it and they still didn't have that sex drive at all. So it's pretty scary.
Yeah, it is. And yeah, again, another reason I'm glad we're having this conversation, just so people who might be thinking about taking the medication could realize that you can address the cause of the hair loss. So why is it important to figure out what type of hair loss someone has?
Oh, that's really important, because you need to address it as soon as possible, because you have to isolate the root causes. There's different root causes, and there's different types of hair loss, and you have to address them differently. There's no one size fits all. And also, it's easier to stop the process from getting worse and thicken your existing hair than regrow your hair that's already gone. And then, to get more technical, hair follicles become very tiny, and they call it miniaturization. And scarring can take place, especially with female hair loss. These conditions usually progress through hair shedding, and The more shedding, the faster the miniaturization can take place. And this can cause scar tissue compacting all hair follicles, making regrowth nearly impossible. And then hair growth exhibits enormous cellular turnover. Some people call it a mini organ because it has such an active metabolism requiring really good nutrients and absorption of those nutrients, which requires an enormous amount of energy. So if you're not absorbing your nutrients, or you're not eating enough, or if your body's unbalanced, then it's really hard to achieve hair growth. And like you probably get a lot of clients, as I do, who come to you and they might be eating well, but once you start doing functional labs, you're like, oh gosh, they're not even absorbing their protein or their healthy fats or something, and they're way out of balance. So it's peeling back the layers and just getting on it right away.
Yeah, I mean, no, you're right. I mean, people I work with mostly have thyroid, autoimmune thyroid conditions, so hyperthyroidism, Graves' disease, hypothyroidism, Hashimoto's, and of course, the thyroid hormone imbalance can be a big factor. But like you said, if they're not absorbing nutrients, that also could play a huge role when it comes to hair loss. So why don't we talk about the different, or what? I'll let you talking about some of the different types of hair loss. And again, we're going to focus on hormonal hair loss, but feel free to talk about other types as well.
Sure. Well, the hormonal hair loss is called chronic telogen effluvium. And the main causes are hypo and hyperthyroidism, like SIBO, dysbiosis of the gut, actually nutrient deficiencies or surpluses, and heavy metals toxicities. Those are the main causes. And then there's lab tests, functional lab tests that I know you do too as well, but they can help address it right away, like the full thyroid panel, the SIBO breath test, stool analysis, food sensitivity panel, of course, the heavy metal trace, and even looking at the parathyroid. So that's the hormonal one. And then the gut, depending on whether it's healthy or not, really can produce or block hormones that cause hair loss disorders. They've really linked it in a lot of studies. And what happens is disruptions. We have not only our gut microbiome, but we have our skin microbiome. And now they're saying we have our scalp and hair follicle microbiome. And what it becomes systemic. If we have dysbiosis, it's not like what happens in Vegas stays in Vegas. It's not that. It's systemic throughout our entire body when we have that dysbiosis of our gut. And it also has a huge impact on our endocrine system, the tissues that regulate the production and secretion and the metabolism of different hormones, including our sex hormones. And that being said, so if there's any dysbiosis in the gut, studies really show that shifting that bacterial balance to the positive can have a huge favor in hair growth and hair health.
Yeah. So again, just another reason to make sure you focus on, restoring the health of the gut. And I know you're going to talk a little bit about the 5-hour protocol, which I definitely recommend to my patients as well. But before doing that, well, I guess a couple of things. So one thing with the lab test. So you mentioned, SIBO, small intestinal bacterial overgrowth, which, that could affect the absorption of nutrients and
Sure.
factor. And then you also mentioned maybe sometimes doing like a comprehensive stool panel. I guess the question is, do you recommend those tests on all of your patients, or does it depend on the history? Especially
absolutely. It depends on the history. Again, there's no one size fits all. And I didn't even mention like the Dutch test, the hormone test. That's important too. Again, I know you do these, but I take each client case by case. I have them fill out. I don't know. Do you use the Living Matrix questionnaire?
I don't. I'm familiar with it from IFM, correct?
Yeah, right.
So
puts together a timeline of the client, and so you start to put together patterns, and it helps with detective work of deciding what labs to run on them or not. But I mean, I like you. I like to test and not guess, because you can waste a lot of money and time just going down the wrong path.
Yeah, I agree. It's like a catch-22, just because I try not to, I don't want to over recommend testing. I don't want to go crazy
Sure.
with the testing, but as you mentioned, you could also waste a lot of time if someone doesn't do any testing, or they just do like one test at a time. So, I would say I'm a little bit more on the conservative side, but that being said, I do run a number of comprehensive stool panels, and SIBO testing is more based, I mean, the comprehensive stool test also based on the health history, but I'd say the SIBO test, at least in my experience, the symptoms are usually more overt. And even that's not always the case. You can't always go by symptoms. And that's the challenge when dealing with really with any kind of condition, but including gut. Someone might experience constipation, diarrhea, gas, bloating, but there are also people who just feel fine from a gut perspective, digestive perspective, and then you might do a comprehensive stool panel and still pick up H. pylori or something else. And same thing sometimes with SIBO. There's no perfect method going by symptoms or doing testing, so you kind of have to pick and choose. And yeah, like you said, I do prefer to try to find answers rather than just say, oh, let's treat someone blindly for SIBO, or let's just assume that they have H. pylori and treat them for that. So yeah, I think we're on the same page with that.
Yeah, and that goes right into the 5R protocol, because I spend a lot of time in the first R, remove. There's usually a plethora of things they need to remove and get imbalanced before. And I usually take people off all supplements, and people come to me and they're on supplements. They don't even know why they're taking them, I'm like, well, and they're not even on good quality ones. So it's education as well, and then go through the replace, reinoculate, repair, rebalance. And again, it's a little different for each person, especially if they have SIBO. You have to be, as really careful about some probiotics, prebiotics, and it can be a fine line.
Yeah,
I think it's really fascinating, though. I love the detective work part of it.
No, I agree. It's it's challenging. I mean, sometimes it can be frustrating because certain conditions, like again, deal with a lot of Graves and Hashimoto's patients, and
Sure.
autoimmunity is complex, regardless if it's a different type of autoimmune condition, still could be complex. But you are right with that first R, because a lot of people will be taking probiotics or digestive enzymes or drinking bone broth, and those are all part of the 5R, just the other phases, the other R's of the protocol.
Sure.
But a lot of people will neglect that first R, which is remove. And if you don't remove the factor that is causing the increase in intestinal permeability, that leaky gut, causing the dysbiosis, then you're not going to heal the gut.
Right. Exactly.
We're also going to talk a little bit after about the fecal microbiota transplant. So I'm excited to chat with you about that. But also let's talk a little bit about some of the, I guess, causes of the disrupted gut microbiome, the leaky gut. I know you mentioned like food sensitivity testing. So there's food. So yeah, I'll let you talk a little bit about that. Expand.
Do you want to put up that diagram, or do you want me to just go through it?
Let me see if I could put it up here. All right.
Well, while you're doing that, I just want to mention too that pandemic, I'm just going to call it the pandemic, has been really devastating for hair loss, especially for women, just because of our hormonal makeup. I mean, they're experiencing, and it's also hair loss between 1 and 4 months after getting it. And they're really, really struggling. I mean, there's Facebook support groups that are like 11,000 women. I mean, men can join too, but it's really affecting women, the hair loss after the pandemic. And I really believe that maybe they got it so badly just because their gut's out of balance. Because if you look at this tree that I put together of root causes.
And actually, before you mention that too, this is also going to be on the podcast. So for those those listening on the podcast, I'll make sure. So there's going to be a link in the show notes with Julie's permission where I could
Sure.
link
Absolutely.
so you could also look at what we're looking at now.
Right. Because as I said earlier, and as we just discussed, hormones are created in the gut anyway. So if you get that imbalance, then that's part of the chronic inflammation, and then you're going to have nutrient deficiencies, malabsorption, the high DHT. Even women can experience that. Crash diets, poor digestion, even chronic insomnia, under-eating, over-exercising, under-exercising, high fever, infections, pathogens, parasites, autoimmunity, dietary, I mean, heavy toxic overload, like we talked about, heavy metals, even trauma, PTSD. I mean, the last couple of years have been pretty traumatic for a lot of people. I mean, the list goes on and on. Candida, people don't associate hair loss with Candida fungal overgrowth. And then a big one is the thyroid. And I want to mention that gluten, especially with your Hashimoto patients, there's a huge link between gluten and thyroid. And even with hair loss, because it's a cross reactivity with the gliadin antibody, and it attacks the hair follicle. And they've also done studies on it proving that even alopecia, which is the autoimmune hair loss, they did one particular study, and the subject was doing pretty well, and then started eating a gluten-filled diet again, started eating gluten again, and the hair loss got worse. There's a huge, that's one of the big causes, and making it just worse, mediator of everything, that.
Mm-hmm. Yeah, I mean, I wouldn't make the connection directly. So you said there's a cross reactivity where gluten, the body attacking the hair, like, is it the body?
The gliadin part of the gluten protein attacks the hair follicle.
Oh, wow. Okay. That's interesting. But of course, gluten itself, in a perfect world, we would all, avoid gluten. Very important for especially those with autoimmune issues, gut issues. But I think it's a 2015 study that showed that gluten can cause a leaky gut in everyone. So even if someone doesn't feel bad when eating gluten, you really want to ideally cut it out from your diet. So, but especially if that could play a role with hair loss, then that's another reason to avoid gluten. And nutrients. So you mentioned, well, you didn't mention well, you did mention, I think, but it's also on the infographic here, the dietary fatty acid imbalance. So yeah, fatty acids. I probably should test everybody for that, but it's an optional test when I send my follow-up to the patients. And it seems like almost all the time they're deficient. Now, honestly, I put pretty much everybody on an omega-3 fatty acid. So to me,
Absolutely.
It's not like I'm neglecting it if they don't do the testing. I just say, well, take a fish oil supplement, for example. Yeah, so that could cause problems with hair, even like dry hair, if it's not causing a hair loss. But yeah, this is just amazing, all the different potential causes of hair loss.
Right. And even like vitamin D plays a role in the stimulating new and old hair follicles. So when there's not enough vitamin D in there, hair growth is stunted. I mean, it's just amazing how, even though conventional practitioners now are testing for vitamin D, they might even, I get a lot of clients that come to me and they've been tested for it, but no one managed to tell them, well, you're at 20, you're too low.
Yeah, that you gotta also look at the optimal ranges, which I know you know about. Yeah, unfortunately, many medical doctors, conventional medical doctors, just look at the lab range, which most of the time is like 30 nanograms per milliliter or less. If it's 30 nanograms per milliliter or greater, then they'll say everything's okay. But ideally, from an optimal standpoint, you want at least 50. Some will say 60 to 80. But definitely, if it's in the 20s or teens, you're too low. But even like the low,
absolutely.
Yeah.
And now they're even going up to 100 nanograms per milliliter.
Yes, yeah. Some of the labs, some of them will go up to 80. Some of them will go up to 100 as far as the range. Are you saying that some are recommending to, like, for the levels to go up to 100, or are you talking about the lab itself? Or?
No, I just, some of the new functional levels are going from anywhere from 60 to 100
Oh, wow.
instead of 60 to 80. I'm
Okay.
seeing up to
Hmm.
60 to 100. Yeah,
Um,
let me also mention iron is a big, important nutrient in hair loss, but the caveat is you can also get too much iron and you can lose hair. But that was one of the reasons why I lost hair years ago, is I didn't know I was not celiac, but non-celiac gluten sensitivity. And I was anemic because of that. I wasn't absorbing my nutrients. But it's really important to do a whole iron panel, just like do a whole thyroid panel, because you want to look at the ferritin. And the ferritin to have hair growth needs to be at a minimum at 70. But if you get over 300, you're going to lose hair. It's way too high. Some practitioners say over 200. So there is a narrow range, just like the thyroid.
yeah, that is true. One thing I will say, which again, I'm sure you know about with iron, and this is another reason you want to do a full iron panel, is ferritin could also increase due to inflammation. It's an acute phase
Absolutely. So
reactant.
can iron, though, even just an iron marker.
But I do see, yeah, I mean, if everything, so if you do an iron panel and if like everything, serum iron, iron saturation, ferritin is high, I mean, it could be inflammation, but also you need to be aware it could be an iron overload. Whereas if iron is looking good, iron saturation is looking good, the TIBC is looking good, yet ferritin is, 300, 400, then that's probably a good indication of inflammation over iron overload. I mean, yeah, if everything else looks good, but ferritin is high, it's probably not iron overload, probably more inflammation. But that's good to know as far as you don't want, you need ferritin to be at a certain level when you're dealing with hair loss. And, you don't want it to be too high. You're right. High
Yeah.
iron can cause oxidative stress, which overall is not a good thing for the body, not just for the hair. What are your thoughts on biotin and hair loss? Just because a lot of people will run to get the biotin.
Oh, let me just add one more thing about the iron, and then I'll get into the biotin. But the iron is really important because if it's too low or too high, it affects the hair growth cycle. So that's why it needs to be.
Oh, okay. Well, thank you. Thanks for sharing that.
Yeah, biotin is way overrated. It's like the last hair nutrient you need, because if you don't have enough biotin, it can cause dry, brittle hair, but it doesn't help in the growth process. I don't know. They put so much biotin in these hair supplements. It's ridiculous. It's like they haven't done their research or something, but it's way overrated. That's my answer.
Okay. Yeah, that's good to know. It's so I mean, if it's part of a B complex or multivitamin, maybe not a big deal, but what you're saying is that people shouldn't run out to the health food store or go online and just order a separate biotin supplement when it comes to hair loss.
No, there's more other supplements that are more important, because biotin really just helps so that your hair doesn't get dry and brittle and start thinning. But you need the hair growth supplements like macronutrient. And it's interesting, like protein, our hair is mostly protein, but it's the branch chain amino acids that you get in only animal protein. So that's why a lot of vegans, vegetarians struggle with hair loss, because they're not getting those branch chain amino acids.
Yeah, so you recommend, of course, eating more. You're making sure you're getting some animal protein into the diet, and again, it all comes down to the gut too. Because even if you're eating animal protein, but if you're low in hydrochloric acid, low in stomach, in digestive enzymes, and just having issues with digestion, malabsorption, then again, you might not be digesting, absorbing the amino acids, which also could play a role with the hair loss.
Absolutely, absolutely. And there was another study done on a subject who had H. pylori, and once losing hair like crazy, and once they corrected that H. pylori, the hair started growing back. Just goes back to what you were just saying, that their absorption was all messed up. So how can you grow hair?
Yeah, yeah. H. pylori, for those who are unfamiliar, it's a bacteria in the stomach, and that could affect the stomach acid and stomach acid secretion, which again is important for breaking down nutrients and amino acids. And another reason why if you have H. pylori, in my opinion, you want to get rid of it. There's some debate about H. pylori in the functional medicine world. But do you want to dive into the fecal microbiota transplants? I know there's an abstract, right? You have a new published abstract, and which has 4 associated studies on the.
Absolutely. I do. I have a published abstract, and there's 4 subjects. One was a 20-year-old man. He had C. diff, and then he took the fecal transplant. So your listeners know, I call it the gut reset.
As the name implies, with the fecal microbiota transplants, it's pretty much transplanting putting the stool of one person into another person. And of course, they do testing and just not done as much as it probably should be. I think still in the United States, it's only officially for those with C. diff. I don't know if that's changed. I know there's functional medicine practitioners who will recommend it for other conditions, of course. But I think really, just as far as the conventional medical world, it's still just known in the US for C. diff.
Right. But they did do these studies. One did have C. diff. He's 20 years old, and he had alopecia universal. So that, again, that's losing hair all over his entire body. And after the procedure, he grew hair everywhere. I mean, where he's supposed to, where he hadn't seen hair for years on other part, on his head and other parts of his body. A 38-year-old man also had alopecia universalis, and the same, he saw dramatic hair growth afterwards. A 34-year-old woman had ulcerative colitis and hair loss, and she had a huge improvement with hair growth even after a 6-month follow-up. And then my favorite one is an 86-year-old man. And again, this man was told he'd never grow hair, just like these other people in this study. These are published studies. But he had a history of colon cancer, depression, and diarrhea. And he grew his hair within 4 weeks after the procedure. He had alopecia, and also it improved all his other health issues. So yeah, you're right. They're mostly doing this for other reasons in Europe and Canada. We're always far behind. But the reason I like to mention this is because it proves the fact that if you clean up your gut, get it in control and in balance, that you can grow hair and obviously help other conditions. It just I think just proves the point. It's pretty radical and it's not easy to get, but I like to mention it because it proves the point that, again,
just the connection, how important the gut, if you take the stool from, a healthier person or a healthier stool and someone who's not as healthy, just seeing that dramatic impact that it has on their health. And just, again, talking not just about gut issues, but again, hair, which again, alopecia, again, actually I know. So alopecia areata, I mean, pretty much, I think are all of them autoimmune. Again, I've written
they're all androgenetic universalis. There's a bunch of alopecias, but that areata is the most common, and that's the one that Jada Smith is experiencing.
Yeah, so this is definitely timely because of that, and yeah, unfortunately, the medical world again doesn't do anything to help with the gut, to focus on the autoimmune component. Same thing with Graves, Hashimoto's, other autoimmune conditions. But definitely is hope, and yeah, just amazing the connection with the hair loss, because a lot of people might be surprised how in depth we're going with the gut. But yeah, it's if you have an unhealthy gut in so many different ways, that could affect hair loss as well as, of course, other aspects of your health. But this episode is focusing on hair loss. So just if you think you've done everything, taking supplements, especially as you mentioned, biotin, and and again, if you have iron deficiency, if you're not eating enough protein, I mean, there's so many different factors that could lead to hair loss, but a lot of these different factors are arguably most of these factors related to the gut. So it's great that, you went into so much depth about the gut microbiome and even talk about the fecal microbiota transplants and showing the research. And because, yeah, it's important to show the research when it is available And hopefully with the years to come, there'll be more and more studies showing, the relationship between FMTs, fecal microbiota transplants, and hair loss, as well as other health conditions. But yeah, thank you so much for sharing this.
Yeah, and just let me mention another study just published in the Journal of Nutrition Medicine and Diet Care found really strong evidence linking the gut to the diet. So, and with development or not of alopecia. So I thought that was interesting to mention, because still people are not convinced that the diet is going to have a huge role on our hair health.
Yeah, and it's not just about gluten, of course. We spoke a good amount about gluten, but yeah, we spoke about some of the things you should avoid, but you're right. Some of the things that we should be eating to help support the microbiota, just like plenty of vegetables, trying to eat a good variety of vegetables. I assume you agree, just mostly whole food diet, plenty of vegetables.
Absolutely. Yeah. And a supplement that people don't think about also with hair loss is the flushing niacin, because it gets the circulation to the scalp. I mean, throughout our whole body, but our scalp, that's another problem. People aren't getting any circulation to their scalp. So the flushing niacin helps break down the buildup of DHT and calcium that can often cause hair loss as well. And just like a simple hack of like standing on your hands, standing on your head, getting that circulation to your scalp. It feels good too. And just sleeping on a silk pillowcase retains the moisture in your hair, and it's good for your skin. And there's some simple hacks to just keep things better aligned.
Yeah, that's interesting.
Yeah.
So you recommend like hanging upside down or something?
Yeah, like an inversion table,
Yeah.
or just whenever you go to the gym, stand on your hands, stand on your head. Getting that circulation to your scalp is really important.
What's your thoughts? So you mentioned the flushing niacin as a supplement. Do you have any thoughts on silica?
Yeah, silica, collagen is great. Those are great. Selenium, zinc, manganese, those are other top ones, which also help with, as you know, thyroid health. The selenium, and that's
Yeah.
another tricky one. A lot of people end up thinking, oh, I need to take selenium, so they end up taking too much. That can,
Yeah, or they combine that with Brazil nuts and
yeah,
and take too much. Same with iron. You get the iron, too much iron overload, and with selenium, that's definitely the case. Other nutrients like something like magnesium, probably not as big of a risk. I mean, you could overdose, I think, with anything, but the
sure.
consequences, the side effects could be a lot worse with taking too much iron and too much selenium compared to too much magnesium. Now, is there anything else that we should discuss? I know we covered a lot, but I want to make sure. Obviously, I'm sure we could go another hour or two, but as far as focusing on the gut, focusing on hormonal hair loss, I want to make sure that there's nothing else that we left out that you think is important.
I don't think so. I mean, really going through the 5R approach, just to reiterate that again. I know you do that as well, just because, you can just jump in there and not get to the foundation of what's going on. And you can just waste so much time and energy. And I know it's all based in functional medicine and nutrition. There's other practitioners out there that I know they're trying to help, but they can be more of a detriment than helping because they're not starting at the beginning.
So let's say someone listening to this, if they're experiencing hair loss, and of course there could be many different causes as we discussed and showed on the infographic. So where would you start? It sounds like you would start with that 5R protocol.
Right. I would start, with my questionnaire, and then with the functional labs, and then with the first R, building from that. I get a lot of clients with hair loss that come from like dietitians or other practitioner dermatologists who would just throw supplements on them and say, eat better, but it's not all about that. I mean, you might even be eating well, but you're under chronic stress. So you're not absorbing your nutrients. So there's some, high histamine, and there's something going on in your gut where you're not even absorbing your nutrients. So, I mean, then I have to start over with them, and they get frustrated because they already spent money with these other practitioners. I'm sure you get those people too. You have
Yeah.
to, start with the basis. I mean,
Yeah, I mean, I agree. I mean, diet is a piece of the puzzle without
right,
question, and it's something that I think pretty much every functional medicine practitioner recommends, or hopefully recommends to their patients and clients to eat
right,
whole, healthy diet. And food definitely could be part of that first R of the 5R protocol. Like
right.
we mentioned, gluten. There's others like dairy, corn that could also, be
Sure,
factors. But as we also mentioned, there could be gut infections. There could be H. pylori. There could be parasites. There could be,
right.
SIBO is not really an infection, but again, to overgrowth.
Epstein-Barr virus. That's what I had.
Yeah, it's, different viruses, and like you said, stress just by itself could have such an impact on our gut and our overall health. And of course, I need to mention, being that a lot of people listen to this, or most people listening have a thyroid or autoimmune thyroid condition, even though you definitely want to focus on the gut, but sometimes you do need to initially, you might have to take, in the case of hyperthyroidism, whether it's anti-thyroid medication or like herbs such as bugleweed, which is what I took when I dealt with Graves, or in the case of Hashimoto's, maybe take thyroid hormone replacement. So I guess it's important also to mention that focusing on the gut is important, but you might need to do something to also, take something to help balance the thyroid while you're addressing the cause of the problem. And in the case of hyperthyroidism, the goal isn't to be on methimazole or any other type of anti-thyroid medication permanently. And the same with the herb. Now, with Hashimoto's, it might be a little bit different. There are definitely people that need to be on the thyroid hormone replacement long term. But I wanted to bring that up just because I agree that having a healthy gut and incorporating that 5R protocol is important. But in many cases, people do need to take either the medication, or in some cases, like hyperthyroidism, herbs to help with the balancing the thyroid hormone.
Absolutely, absolutely. And also determining their food sensitivities. I know a lot of practitioners, and I used to do it when I worked in a functional medicine practice with an MD. We would put them on the elimination diet, just the first appointment, but they really, really struggle with it. And what I find more effective, what I do in my practice, is I test them, a blood test for food sensitivities, because then they know, they see it. They're like, okay, well, whereas the elimination diet, they really might be eliminating something that they don't need to, because everyone is so different. I know there are top food sensitivities, but at least in my experience, when they can actually see it, it's more helpful.
Yeah, it's a good point. Now, I will say, in our practice, we do a lot of the elimination diet. You could go back and forth as far as, I don't think there's a perfect method, but what I've been thinking about doing in the future is doing both, actually, where I have them start out, maybe at least giving them the option of doing like a food sensitivity test. And there's one I'm looking into that I'm sure you heard, is like mediator release testing.
Sure,
Uh,
MRT, right?
yeah, MRT. There's also, IgG testing as well. But I guess either way, like starting with that and then also incorporating an elimination diet, because yeah, I think there's benefits, there's pros and cons of each. With the, you're right, like you might eliminate something maybe you don't have to, or you might be eating something that you're sensitive to. Like for example, an elimination diet, usually you won't be eliminating like broccoli or avocados, but there's a chance you might be reacting to that. And food sensitivity testing, is not perfect either. So I've actually been thinking about in the future, maybe combining the two, or at least giving the option for the patients. If they just want to focus on one or the other, that's fine. But yeah, I'm glad you brought that up as well. And it's just another example of how different practitioners practice differently, just because,
Right.
again, I can't say I've been a huge fan of the food sensitivity testing, over the years, but recently I've been opening up my mind a little bit more. And like I said, I'm looking maybe to incorporate both of them, or again, give the person I'm working with the option. If they just want to do the food sensitivity testing and not the elimination diet, that's fine. Or if they don't want to spend the money on the food sensitivity testing and just do what I've been doing for years, the elimination diet, that's perfectly fine. So, but yeah, thank you.
Well,
Thank you so much for.
yeah, well, we should talk, because I agree there's a lot of really bad food sensitivity tests out there, and I only trust a couple, and one of them is newer in the market, and they take insurance like a lot. But what I like about it is they test not only the IgG, but the IgA, the IgE, the IgG4, and the complements. So you're seeing that their allergies, their sensitivities, and the complements. And I mean, it's like 188 food. I don't know. It's a good amount of foods. And then you can layer it, and it takes most major insurance companies. So I like
That's
that.
really good. Yeah, that is good. I mean, I've used Cyrix Labs in the past, and I do like Cyrix as well, but they are a little bit pricey, and I don't think insurance will cover them. And then the ones that you could order on your own. I don't want to mention any names when talking about ones in a negative light, but there are
Right,
ones
right.
that you order on your own, and do from the comfort of your own home. And I don't know. I'm not saying either of the. I mean, I guess yeah, there are ones that definitely I feel are not too accurate, and yeah, so no, that's a good point too. Really, with any test, that's been the case, even with comprehensive stool tests, where
Sure.
there's ones that I've done and I stopped doing them just because I didn't really find it to be accurate, and now stick with more like I like the GI map. I think
I
Genova,
love that.
yeah, the GI effects even from
Yep.
Genova, that's also pretty good too. But yeah, you're right. That's a great point because some people might, in this day and age, you can order tests on your own. People could just go online and search
Sure.
and but again, you don't know, just like the supplement you mentioned, quality is important when taking supplements, but we don't think about it with tests, or we think about it, you and I think about it, but the average person thinks, oh, a test is a test. So a stool panel is a stool panel, food sensitivity test, food sensitivity test. And we could talk about other tests too, but the point is, you're right. Choosing the correct lab is extremely important as well.
Yeah, and there's a lot out there. They can waste a lot of money on a lot of, I don't even think that's regulated, is it? Those labs?
The ones that we're talking about, you mean,
Oh,
or?
no, just like labs in general. I don't think they're regulated.
Yeah, I don't think so either. I'm not
Yeah.
100% sure. But
Yeah.
yeah, this was a real good conversation. We went places I didn't think we would go, which is I think is good. I think we went a little bit towards the end beyond hair loss, but again, it's important. I guess it does relate because again, we spoke about food sensitivity testing, which that ties into what was discussed earlier.
Yeah,
Again,
with food loss. I mean, with hair loss, definitely. It's like picking a scab. If you keep eating those foods you're sensitive to, it's gonna affect your hair as well.
yep, yeah, very very good points. So yeah, thank you so much for sharing everything. And where can people find out more about you?
Um, they can go to my website at julieolson.net, and that's an O-N, so Julie, OLSON.net. And I have a phone number on there, my office number, and
All
they
right.
can find me on social as well.
Okay. Instagram and
Yeah, all of them.
okay, wonderful. I'll make sure to include links in the show notes. And again, thank you so much, Julie. Appreciate you joining us. And yeah, you shared a lot of valuable information.
Well, thank you so much, Dr. Eric. It's really a pleasure. We'll talk
Yeah.
soon. Okay.
Yeah. Thank you.
Thank you.